Hi, my name is Abigail McEnroe, and I'm going to tell you all about Alzheimer's disease. For the introduction, what is Alzheimer's disease? It is a progressive disease that destroys memory and other important mental functions, and this is where the brain cell connections and the cells themselves degenerate and die. And this disease is irreversible and tends to develop in people during their mid-60s. The history behind Alzheimer's disease is in 1906, Dr. Aloy Alzheimer had a patient who experienced memory loss, psychological changes, and paranoia. And after the patient passed away, an autopsy was done, which found shrinkage in and around nerve cells in the patient's brain, which Dr. Alzheimer later labeled Alzheimer's disease. Some important statistics with Alzheimer's disease is that it is labeled as a very common disease with 3 million US cases per year, and there is currently 5.8 million cases. Between 2000 and 2017, there was a 145% increase in cases, and it is the sixth leading cause of death in the United States. Also, 1 in 3 seniors dies with Alzheimer's or other related dementia. At the age of 65, women have a 1 in 5 chance of developing Alzheimer's, while men have a 1 in 11 chance. And the number of cases is expected to triple in the next 40 years, which would range close to 14 million cases. So the causes of Alzheimer's disease may be a combination of genetics, lifestyle, and environmental factors, but the causes are not completely understood yet because it is rare, less than 1%, to have certain genetic mutations cause Alzheimer's. But problems can arise with specific brain proteins, plaques, and tangles that do not function normally. These proteins interrupt the work of neurons and can unleash a series of toxic events. And if the neurons are damaged, connections will be lost and the brain cells will die. So for plaques, amyloid plaques form when clusters of leftover beta amyloid disrupt cell-to-cell communication and leave a toxic effect on neurons. And tangles form when tau proteins change shape and organize into neurofibrillary tangles, which disrupt neurons' transport system and internal support system. And over here, there's pictures of plaques and neurofibrillary tangles. And other risk factors include increase in age, your family history, if you were diagnosed with Down syndrome, your sex, if you were diagnosed with mild cognitive impairment or MCI, if you've had past head trauma, poor sleep patterns, and any type of lifestyle factors, including lack of exercise, obesity, and smoking. The clinical manifestations for Alzheimer's disease include memory loss of recent events and conversations, and people with Alzheimer's may have increased trouble with thinking and reasoning, specifically difficulty concentrating with numbers or any type of analytical data where they need to count or look at numbers. They may have trouble with making judgments and decisions, especially poor decisions in clothing, depending on the season or the weather, and also poor decisions when handling conflict, like any type of problem or situation that they're in, or even a fight. They also may have trouble with planning and performing familiar tasks, especially struggle with sequential tasks like cooking, games, planning, dressing, and bathing. They might not know what steps are in what order. And they also have trouble with changes in their personality and behavior, and depression, social withdrawal, wandering delusions, and irritability can be seen from family members or anyone from the public. A neurologist is the type of doctor that diagnoses people with Alzheimer's disease. They would perform evaluations of medical history, medication history, and signs and symptoms. And these type of evaluations will look more in depth to impaired memory or cognitive skills, changes in personality and behaviors, how thinking affects function and cause of the symptoms. And also evaluations will be done to test reflexes, muscle strength, sight and hearing, coordination, and balance. There is an ability to rule out other possible diseases through lab, specifically blood tests. There is mental status testing, neuropsychological tests, and interviews with family and friends can be used to show signs and symptoms. There's also brain imaging tests like MRIs, CT scans, and PET scans that can have a focus in amyloid and tau protein detection, which would further confirm plaques and tangles. And Alzheimer's can certainly be diagnosed after death with microscopic examination of the brain because the plaques and tangles would be present. And down below, there's a picture of a healthy brain, a mild Alzheimer's disease brain, and a severe Alzheimer's disease brain, which I will be talking about in a few minutes. The treatment for Alzheimer's, there's no cure that exists, but there are different types of self-care routines that you can do, especially frequent aerobic exercising. There's also cognition enhancing medications that can be taken to temporarily improve symptoms, and it can also improve mental function, lower blood pressure, and it has a possibility of balancing your mood. And there are future treatments that doctors are looking at because they're looking beyond present symptoms and looking ahead to underlying diseases. And some of these interventions that doctors are testing right now include immunization therapy, drug therapies, cognitive training, physical activity, and treatments for cardiovascular disease and diabetes, because those two diseases may be the underlying diseases that could cause Alzheimer's. The prognosis for Alzheimer's disease, it tends to develop slowly and it gradually worsens over the years. People will live an average of 3 to 11 years after being diagnosed, and your life expectancy depends on the degree of impairment because there has been cases where people lived over 20 years after being diagnosed. It really just depends on how severe your signs and symptoms are. There are 5 stages in Alzheimer's disease. The first stage is preclinical Alzheimer's disease, and this only can be detected by research and imaging because the symptoms are not present. The next stage is mild cognitive impairment due to Alzheimer's disease, also known as MCI. And this is when mild changes in memory and thinking occur, but the changes aren't significant enough to be diagnosed with Alzheimer's. The next stage is mild dementia due to Alzheimer's disease, and this is when AD is diagnosed and troubles with memory and thinking occur that impact daily functioning and daily life. The next stage is moderate dementia due to Alzheimer's disease, and this is when the person is growing more and more confused and forgetful, and they need help with daily functioning and activities. And the last stage is severe dementia due to Alzheimer's disease, and this is when it impacts movement and physical capabilities, along with all the other symptoms like being confused and forgetful and needing help with daily functioning and troubles with memory and thinking. And between mild, moderate, and severe dementia, this is when family and friends will be able to see the symptoms and the public will be able to see that this person does have Alzheimer's and that they do need help with daily functioning. Lastly, caring for Alzheimer's disease, support for families and caregivers is very important because the demands are really high for family members who have a person in their family or friend that has Alzheimer's disease. So the best strategy to start with is becoming well informed with the disease and looking up stats and different facts to see how you can help your family member or friend. And also good coping skills, strong support networks, and respite care are also very important for family members or caregivers. And like I said, the demands are very high, especially physically, emotionally, and financially, just from the treatments, like the medications or any type of having to work with them or going places with them may cause high stress. So any type of exercising on your own or joining support groups can help with the stress and concerns of your patient and family member, especially going to the support groups because you can talk with other people who are going through the same thing as you and to express your concerns and different strategies to help with your family member or friend or patient who is going through Alzheimer's disease. Thanks.